So the top-down approach, in my opinion, is more the traditional approach, and it's identifying the top trend drivers, the highest cost drugs and the highest cost disease states, and focusing all of your efforts on the top drivers, and which is a good thing and should be done, but then just really focusing everything on those and not what falls beneath it. With specialty drugs, you affect a very small percentage of your population, yet it contributes to a large portion of your costs. So by narrowly focusing just on your top trend drivers, you may be missing opportunities for additional cost savings. In my opinion, I believe it's not the most cost-effective. I believe it's an effective approach, and it is the approach that's been taken on the traditional side. But because specialty, again, affects small, numbers of your population, but contributes to high amounts of your cost, I believe you're missing opportunities if you don't do other things other than looking at the top down. So, for example, drugs that affect rare diseases, multiple times in different presentations over yesterday and today, we've heard where a small employer group had one hemophiliac that drove all of their specialty spend and trend, and that's just one person. So when you look at a rare disease, and a drug that may cost you a couple $100,000 a year, if you have one or two of those in your population of people, it's going to make a difference. And again, that would never hit your top-down approach because it's not going to be, necessarily your highest therapeutic class or your highest in terms of drug utilization, but yet it's contributing huge amounts to your cost.